Hi friends, good evening and welcome back to my channel Mukambika Nursing. Friends, here we are discussing MNS exam previous year questions and answers. MNS exam is on 14th January. Hall ticket can download from official website, and also we are discussing ESIC previous year questions. You can see today's first question. The hormone glucagon is secreted by options. Option A, beta cells of pancreas. Option B, parathyroid gland. Option C, pineal gland. Option D, alpha cells of pancreas. Glucagon is secreted by alpha cells of pancreas. Option D is the correct answer. Islets of Langerhans in the pancreas contain three types of cells. They are alpha cells. Alpha cells secrete glucagon, beta cells secrete insulin, and delta cells secrete somatostatin. Here our question. Glucagon is secreted by alpha cells. And the next question, the gland which can be classified as endocrine and an exocrine gland is. Options: option A, thyroid gland. Option B, thymus gland. Option C, pancreas. Option D, pituitary gland. Both endocrine and exocrine gland is pancreas. Option C is the correct answer. Move on to the next question. Islets of Langerhans are present in options. Option A, liver. Option B, spleen. Option C, stomach. Option D, pancreas. Islets of Langerhans are present in the pancreas. Option D is the correct answer. Move on to the next question. Time limits for registering birth within. Option A, 21 days. Option B, 25 days. Option C, 7 days. Option D, 30 days. Birth should be registered within 21 days. Option A is the correct answer. The Registration of Birth and Death Act passed in 1969. According to that, the birth, death and stillbirth should be registered within 21 days. The next question, 1 tablespoon is equal to options. Option A, 5 ml. Option B, 15 ml. Option C, 10 ml. Option D, 30 ml. 1 tablespoon is equal to 15 ml. Option A is the correct answer. 1 tablespoon is equal to 4 grams or 4 teaspoon or 15 ml or 15 cc or half ounce. Here 1 tablespoon equal to 15 ml. And the next question, which among the following is a high risk drug? Option A, injection Avil. Option B, injection paracetamol. Option C, injection perinom. Option D, injection potassium chloride. And the correct answer is option D, injection potassium chloride. Why? Because a rapid infusion of this potassium chloride can cause cardiac arrest that may lead to death of the patient. So it's one of the high risk drug. We should give slowly. Potassium, injection potassium should not be given by intravenous push or by intramuscular or by subcutaneous route. It should be given in a diluted form. Before administering this potassium chloride to the patient, nurses should check the renal function test and also monitor the intake and output. The next question, antitussive drugs are drugs that inhibit. Option A, cough. Option B, sweating. Option C, itching. Option D, excessive tears. Antitussives are drugs that inhibit cough. Option A is the correct answer. And the next question, MDP Act was passed by Parliament in the year. Option A, 1961. Option B, 1971. Option C, 1981. And option D, 1975. MDP Act, Medical Termination of Pregnancy Act in 1971. Option B is the correct answer. The next question, abbreviation PRN means. Options, option A, if needed in emergency. Option B, as needed or when required. Option C, alternative days. Option D, after meals. The abbreviation PRN means as needed or when required. Option B is the correct answer. And the next question, enlargement of thyroid gland occurs in options. Option A, hypothyroidism. Option B, thyroid hyperthyroidism. Option C, tumors of thyroid. And option D, all of this. Correct answer is option D, all of this. Enlargement of thyroid gland occurs in hypothyroidism, hyperthyroidism and tumors. And the next question, sleeping pulse rate is classically increased in options. Option A, hypothyroidism. Option B, hypoparathyroidism. Option C, hyperthyroidism. And option D, hyperparathyroidism. Correct answer is option C, hyperthyroidism. Sleeping pulse rate increased in hyperthyroidism. The main clinical manifestations of this hyperthyroidism include goiter, exophthalmos, heat intolerance, diaphoresis, overeating, palpitation, tachycardia, especially sleeping pulse is increased. Also weight loss, diarrhea, eyelid lag. Eyelid lag is also known as lagophthalmos. These are all the clinical main manifestations of this hyperthyroidism. The next question, gastric lavage should not be performed in options. Option A, antipsychotic drug poisoning. Option B, corrosive poisoning. Option C, organophosphorus poisoning. And option D, organochloride poisoning. Correct answer is option B, corrosive poisoning. Gastric lavage means is the removing or cleaning of the toxic substance from the stomach, and it should be performed within 1 hour of injection of toxic substance. And this gastric lavage should not be performed if the person consumed corrosive alkali or acid like kerosene. So here option B, corrosive poison. And the next question, antidote of heparin is option A, vitamin K, option B, naloxone, option C, N-acetylcysteine, option D, protamine sulfate. And the correct answer is it is protamine sulfate, antidote for heparin. And the next question, drug of choice in arsenic poisoning is option dimercaprol, option B, D, penicillamine, option C, naloxone, option D, ergotamine. Drug of choice in arsenic poisoning is dimercaprol. Option A is the correct answer. The next question, all are occupational cancer except options. Option A, liver cancer. Option B, lung cancer. Option C, bladder cancer. Option D, breast cancer. Which one is not a occupational cancer? Correct answer is option D, breast cancer.